Hello, my name is Brittany Klenzar, and I am in Group 4 for this debate, and we are assigned to oppose expanding the Affordable Care Act to undocumented workers. So I'd first like to give a brief introduction on today's topics and provide an overview of why I'm in opposition of expanding the Affordable Care Act. So first, many American citizens are uninsured. I'll first cover the current problems with today's healthcare coverage, as many Americans don't have health insurance. It also may encourage a higher influx of illegal immigrants and undocumented workers. So by extending public benefits, this could negatively impact citizens because others are encouraged to reside in the United States. It's also costly to taxpayers. So the reality of what expanding healthcare may look like for taxpayers is a pretty hefty fund. Next, residing in the country should not equate to public benefits. So I'm not saying that I believe in punishing these individuals. The argument can be made that taxpayer dollars and efforts do not have to be allocated to individuals that are not American citizens. And lastly, social issues and wealth inequities within the country need to be addressed first before extending help. So before expanding coverage, it is important that the lives of Americans are first improved. I'm not insinuating that this is an us versus them situation, but the reality is that many citizens are faced with macro level problems that need to be addressed and given more resources before providing coverage to undocumented workers. It is not as if these individuals cannot receive medical care, as they can purchase private coverage on the individual market outside of the Affordable Care Act and obtain healthcare coverage through low-cost community centers. But allowing this coverage to be free is using resources that could be used to better the lives of American citizens. So as displayed on the graph on the right-hand side, taken from the US Census website, it is evident that many Americans are uninsured, an issue that needs to be addressed before expanding the Affordable Care Act. Since the passing of the HCA, premiums have skyrocketed, leaving more than 4 million individuals who don't qualify for subsidies left to drop out of the market between 2015 and 2018. Ensuring more affordable healthcare coverage to these citizens should take precedence over extending coverage to undocumented workers. As seen here is a survey conducted by the CDC revealing the reasoning that so many Americans are uninsured is due to perceived affordability, or rather the lack thereof, with 7 of 10 attributing lack of coverage to its drastic price. If you'll recall in our assigned readings from previous weeks, obtaining medical treatment can result in people refusing care out of the fear of bankruptcy. Further, the current system is not even aiding those in poor health, with those individuals reporting higher uninsured rates than their healthier counterparts. While I understand the appeal to extend coverage to undocumented workers, there are still serious flaws within the US healthcare system that need to be addressed to provide affordable healthcare to American citizens. I'm not trying to demonize these individuals because at the end of the day, they are human beings. However, laws have been broken, and expanding the Affordable Care Act to cover undocumented workers may result in an unintended ripple effect and encourage illegal behavior. Further, recent polls conducted by CNN found that those polled were not in favor of expanding healthcare coverage, as 59% were in opposition. Is it ethical to expand coverage to individuals who are not citizens if the country's citizens are in opposition? And while the United States is far behind its counterparts in many aspects of healthcare, we're not the only country that denies coverage to undocumented workers, with Canada excluding undocumented workers in 2011. What happens if legislation is expanded? What does this legislation say about the current state of immigration, as it seems to be encouraged residing in the United States without authorization? The ripple effect mentioned in the previous slide may encourage others to illegally reside in the United States, as they would now be incentivized with public benefits. This is not ideal, as immigrants currently consume more public benefits than they contribute to through taxes, and extending coverage for healthcare will only exacerbate this current situation. Given that healthcare in the United States is complicated and very expensive, priority should go to those residing here legally. An argument regularly made by those in favor of expanding healthcare is that these individuals will be able to receive preventative care, which would reduce the price of emergency services in the long run. This is an expensive leap of faith, since research suggests that only 8% of individuals currently seek preventative care that improves health. It is difficult to invest billions of dollars to provide coverage to those illegally residing in the United States with the hope that they will partake in healthy behaviors. How many Americans currently have access to preventative care but still suffer from chronic diseases? Extending coverage to undocumented workers would not come easily and has been estimated to cost taxpayers anywhere from $10 to $23 billion. Moreover, there are additional problems that could arise and affect American citizens if the Affordable Care Act is expanded. A possible influx of undocumented workers that could arise following the expansion of public benefits could impact workers and reduce the wages of natives in competition with immigrant workers by $493 billion annually. In 2019, California became the first state to extend coverage to illegal immigrants and undocumented workers under 25. While this legislation is progressive, it will cost taxpayers $98 million per year. So it seems rather counterintuitive to provide extended coverage through undocumented workers and allocate resources to the cause when an alarming amount of citizens are facing problems with insecure housing and homelessness. For example, California has the largest homeless population of 151,278 individuals. These are problems that families, youth, and veterans face. While insurance is important, it is essential that the lives of Americans are first improved. So just to summarize, a time consisting of a growing homeless population, wealth inequality, and rising costs of insurance for American citizens surely does not indicate that legislation to expand healthcare to undocumented workers should happen right now. There is a pressing need to provide better lives for American citizens before extending benefits to all residing there. Since the COVID-19 pandemic, the number of uninsured people is expected to have risen, which led to mass job losses and likely forced people to lose the coverage they received through their employment. Before rewarding undocumented workers, it is essential that legislation is focused on allocating resources to the millions of Americans without insurance, the millions that have lost their jobs as a result of this current pandemic, and the millions that live in poverty or are starving and homeless. There's a need to fix these issues of American citizens before increasing taxes that these individuals will have to pay to cover undocumented workers. Moreover, the consequences of passing such legislation, such as an increase in taxes and rewarding illegal immigration by extending public benefits, will have a ripple effect that could possibly increase the amount of undocumented workers or overwhelm physicians and hospitals, as these people will now have access to free healthcare, which could result in longer wait times for American citizens. When an airplane is crashing, passengers are advised to put their oxygen masks on before assisting others on the plane. The same can be said for healthcare in the United States. First, providing affordable healthcare for all Americans is the same as putting on our oxygen mask before extending help to undocumented workers. Here's also a list of my references. Thank you.